Well, we will go ahead and get started. And of course, we're in the study session, the very, very first part of what the board does. And we run that from 3:30 to 4. And then the 4 o'clock actual board meeting, the business board meeting, does start at 4. Christine, take it away.
Great, thank you. Let me get this shared up. I just have a very super brief COVID data update for the Board of Health this morning and our partners on the line. So I am just going to present data from Jefferson County today. The data that I had for the state won't be updated until tomorrow, and you've already had the opportunity to review that. So this data, as always, is available on our website if you need to locate it in an emergency. It was last updated on February 10th and will be updated again this coming Thursday. Data that I would like to point out on this slide that we haven't talked about in a little bit is our vaccination data. So we are up to 82.4% of our community being vaccinated with at least 1 dose of COVID-19 vaccine. And that's the eligible population, so those age 5 and above. This is a really fantastic number. If you recall, I had mentioned that the state is estimating that at least 80% of our overall statewide population is immune or has some level of immunity to COVID-19. This number is one of those feeding their communications back to us. This is our trend over timeline. So this shows our case counts since the start of the pandemic. We are approaching that 2-year anniversary. March 5th of 2020 was when we had that first case in the state of Colorado and Jefferson County in particular. So this is the trend over timeline. This large spike at the end is our Omicron spike, which we've become familiar with, and we have continued to decrease our case counts. This is our hospitalization line. So when we look at the severe outcomes of COVID-19 disease, hospitalization and death are the two that we monitor closely. We are seeing a decrease in hospitalizations for Jefferson County residents, as shown in this particular graph. This slide was updated on Sunday. This shows the regional picture of the number of hospitalizations for COVID positive patients. 552, I think that was the number from the last time you saw this slide. On Sunday, we were down to 388 hospitalized individuals across the region. So that shows a overall 30% decline in the number of confirmed COVID-19 patients in the region. And overall across the state of Colorado, we saw a 27% decline for 1 week. So these numbers continue to trend in the very positive direction. This is our death chart. So again, remember that our death data does lag behind by about 30 days. It takes about 30 days to process that information. But we are tracking right along with the state, seeing this kind of double bump. This second bump indicating our COVID wave. And so we are continuing to monitor the data, but the rate of death within our community has decreased as well. And this is the most recent data. This was from an update I received yesterday. Our hospitalizations are down to 1.9 per 100,000. And that's for the week of January 25th through February 7th. And our 7-day counts of COVID-19 cases are down to 188.7 per 100,000. Again, remember, these are reported cases. We know with the increase in the number and availability of at-home COVID testing that this number could be an underrepresentation. So we still do have a significant amount of disease in our population, but the numbers are continuing to trend in the correct direction. And so that our board knows, we do monitor the number of tests that are being performed at our community testing locations, and they continue to see a high number per week at all of our community testing sites. So we know that our community is continuing to be tested for COVID, even though that positivity and that case rate is going down. All of that combines together into a pretty positive outlook for COVID-19 in our community. The other update I have before I turn it back over to, I believe, Jody for continual on this study session would be that we released a new school guidance document, which is available on our website, which matches up with the rescinding of Public Health Order 21006. So this allows our school setting partners across the community to put into action mitigation measures with the reduction in masking requirements for our community. So if you are interested, that is available on our website as well. Happy to take any questions. That's all I have for a data update today.
Christine, thank you. Are there questions for Christine? No questions, Christine. With that, good job. With that, we will go to Jody Irwin, the Deputy Director of JCPH.
Thank you. Good afternoon, everybody. I think on the agenda, it says I'll be talking about whole community inclusion work today. But honestly, a lot has changed since that agenda was created. So I'd like to shift and discuss something that I think is front and center for a lot of our staff and a lot of those in our community, which is the leadership model, the interim leadership model here at JCPH. I'm happy to talk about the whole community inclusion work as well, but I also didn't want to just kind of jump into talking about one of my programs without running that by our interim leadership team first and doing some planning around that. So I'm not sure if I have to discuss that because it's on the agenda. I will if I have to, but if it's okay with the board, I'd like to shift and talk a little bit about, share about our leadership team.
I think that's probably fine. I will defer to our parliamentarian. I'm not sure. Maybe that's Kelsey.
I think that should be fine, especially if you're not taking an action. So I think that's
okay. Thank you. Thank you, Jody.
You bet. Yeah, I promise I won't ask for any kind of a motion. So you may recall that after Dr. Johnson retired, we took a shared leadership approach in the organization where we had our 4 division directors and our executive assistant take on kind of this interim leadership role. We're taking the same approach at this time, but it's going to look a little different this time because a lot's changed over the last year. We now have 8 people on this team. That includes me as the deputy director, our 6 division directors, and some of them are in interim roles that we're looking to hopefully post and permanently fill here in the very near future, and our executive assistant. So several of us that were part of this last time. But we wanted to make sure that all of what are now our divisions were represented on this leadership team. We're meeting every morning, Monday through Thursday, and we're already making progress on a lot of important things, decision-making, walking through difficult conversations, and really pulling a lot of pretty complex things together and approaching them more strategically. So it's felt good so far with the first 2 or 3 meetings that we have. Very optimistic about working with this team. Sherry, you and I talked about this the other day. Nobody can do this alone, especially coming out of dealing with COVID the last couple of years, rebuilding, recovering from incredibly difficult challenges. So everyone on this team is very balanced, thoughtful, team players, committed to the organization and our guiding principles. And honestly, above and beyond work, I just want to say they're all great people. So I wanted to thank them. I know it's going to be a lot of work, but you all give me a lot of confidence in what's going to happen over the next few months. And honestly, in a time when a shining light has not always been easy to find, that's what this team is for me, very much a shining light. So I'm honestly excited about this group and working with them. I thought about this today when I stepped out of my car. It's kind of felt like spring here the last couple of days. I know tomorrow is going to feel tomorrow is going to feel like springtime in Colorado, but there is nothing like springtime in Colorado. And I really have hope that I'm going to enjoy it, and it's going to feel very different for me this year. And part of that is due to this team. I'm again just very excited about this team. We have a lot of work to do, but overall the future feels very bright to me. I also want to acknowledge the support that the board has shown this team. The last time we went through this, we got a lot of great comments and positive feedback from staff. So we're actually looking back on the work that we did. Back then, we had a consultant that we worked with that helped us kind of walk through some of this team building. And so we're going to look back and see what worked and what didn't work. We did a debrief after that. And so we want to make sure that we do all the good things that we did and do those again. We can't do this forever, of course. We know we have to have a director at some point, but I realize that can be a long process. And one of my goals as part of this team, and I brought this up this morning, is to just really set something up amazing for whoever takes on that leadership role next. So it's a big challenge, but honestly, it's a challenge that I'm excited about in a lot of ways, and just honestly looking forward to the future. So in any way that anything I can do to help support this team, support our board, support our staff, and to our staff, I would say, we can do this. We've got this. Work with your director. If you have any questions, concerns, just continue to work with your director and share information with this team that way. But hopefully you'll see a lot of communication, or actually you will see a lot of communication coming from us in the coming weeks and days. So with that, I'll see if there's any questions.
Board, do you have any questions?
I was interested in the communication for the board to the interim team. What's the plan for that? I know that that's something that we want to make sure that you have the support, and that there is that. Obviously Sherry's probably our point, but just make sure we've kind of closed those different loops.
Yeah, thank you. That's a great point. I will be the point person for the Board of Health. And we also discussed this morning, there's going to be some key times when we do need to have Sherry probably participate in those leadership meetings as we kind of have to roll some things up that maybe we can't, that definitely that the board needs to know, or that the board wants to share with us. So I know Lindsay's going to be working on scheduling her to come to some of those leadership huddles.
Great.
Other questions?
I want to say thanks to Jody for the good summary. I appreciate it very much.
Thank you.
Yeah, thank you to the whole team for stepping up. It's very, very appreciated.
Yeah, I think you have a really superior team put into place. Jody, do you think that there's specific any that you can share? I know that you working very closely with the team, but anything, topics or any issues or anything that you see coming up now that we're so happy to say that we've moved into a recovery and sustainable place with COVID, and that we can actually do some more of the work that the department needs to get done, and how the board maybe can support that?
I would welcome the other members of the team to step in and add anything like that. We're going to do some team building. I think that's incredibly important. We have a fantastic consulting firm that was helping us with this big project that got launched last year. That's probably not going to move forward looking the same. So we want to continue to work with them on how to pull just a lot of different things together. Again, as we started through this process of looking at our organization, looking at our structure, and kind of want to take not really a step back, but just really evaluate everything and make sure that all the work that's been done up to this point is going to be carried. Some of it's going to be carried forward, some of it's not. But team building, and I see that Carrie raised her hand, so I'll let Carrie make some comments about that too.
Yeah, I think some of what our team discussed going forward is a few things that are in front of us right now that are issues of importance are the timeline for opening the Parfait building back up open to the public for walk-ins for environmental health and that sort of thing. Addressing the staff to determine what our hybrid work model will be, returning to the building, working from home, and really how we can best support the entire JCPH staff going forward. So those were top of the conversation with the leadership team. And I think Jody summarized where we are pretty well. So I just wanted to add those things. And for those of you who don't know me, my name is Carrie Remersma. I'm the current interim director of family services. So part of what Dr. Margaret Huffman was doing, but that division of community health services is now really kind of two divisions: family health, family services, and then the clinical services led by Kelly Conroy. So if you don't know me, that's who I am, and nice to be here.
Thank you.
Thank you, Carrie. It's nice to have you.
Communication has been a huge one too. And we want to I just reassure folks that we hear you loud and clear, our staff, that we need to get information out. You want to hear communications from us. And that's something that this entire team has been great about. We know that all of us can't always review communications before they go out. So that's one of the models that we're working on is, maybe just a couple people work on this one and a couple people work on this one. So we've really divided and conquered in some neat ways already to make sure that we're getting things out in a timely manner. So we hear folks, they want the information, and we're going to work as hard as we can to get that out as quick as we can.
Great. Any other questions or comments? I will just say that I was very excited on Monday after we sat down and met Jody to talk about the agenda and kind of, some of the thoughts and goals maybe that you had. And I was excited to hear your enthusiasm for the team. And I think that that's really important. And I heard you say it many, many times during that conversation that it really is a team, and that how much you're looking forward to working with that leadership, because we have incredibly smart, professional, good people. And I was very excited to hear you talk about that. So thank you.
No, thank you. No, they're fantastic. I have a ton of faith. It just, like I said in my comments, they give me a lot of confidence, because I know that, if I have any questions, I can go to them, and they respond very quickly with just a lot of brilliant ideas.
Well, thank you. Well, if there's no other comments, then we will probably recess for 10 minutes. The actual board meeting does not begin until 4, and I want to be respectful of that, so I'm not going to start it early. So we will just have a very quick recess and come right back at 4 o'clock. Unless anybody has any other questions. No. Okay, we'll see you at 4. Thank you. Well, I am going to call this meeting to order.
Sherry?
Yeah.
Hi, Kimberly here. I just wanted to remind that we need the interpreter.
Right, we do, and she is
Thank
here.
you. Okay,
Yep.
thank you.
Thank you, Kimberly. So I'm going to call it to order, and then I'm going to have the interpreter go through in her little spiel. So it is now 4:01 p.m., February 15th, 2022, and I'm going to call this Jefferson County Public Health Board meeting to order. And just to remind everyone that JCPH is always dedicated to language justice and interpretation services. And we have someone here with us to help us put this into place today. And her name is Viria Sosa. And I probably totally butchered that name. So please tell us your name and take it away.
Thank you very much. Yes, you're correct. Viria Sosa. Thank you very much. Thank you for having us here. Hello, my name is Viria Sosa, and I am here with the Communal Language Co-op. And we are here to help create a space for language justice. What that means is that we want to create a space where everyone can participate and engage in the language of their heart, or the language that they feel most comfortable in. We will use simultaneous interpretation to create this space. When I finish saying this in Spanish, we will turn on interpretation, and you will see a globe icon that says interpretation. If you are not fully bilingual, we ask that you select your preferred language. When you select your preferred language, you can check mute original audio so you don't hear both languages at the same time. Hola, buenas tardes. Mi nombre es Viria Sosa y estoy aquí con la Communal Language Co-op. Y estamos aquí para ayudar a crear un espacio donde practicamos la justicia del lenguaje. Lo que esto significa es que queremos crear un espacio donde todos puedan participar e involucrarse en el idioma de su corazón o en el idioma en el que se sientan más cómodos. Usaremos la interpretación simultánea para crear este espacio. Cuando termine de decir esto, activaremos la interpretación y verá un icono de globo que dice interpretación. Si no es completamente bilingüe, le pedimos que seleccione su idioma preferido. Si es bilingüe, puede escuchar a todos en su idioma. Cuando seleccione su idioma, puede hacer clic en silenciar el audio original para que no escuches ambos idiomas al mismo tiempo. Thank you very much. Please go ahead and turn on interpretation. Muchas gracias. Vamos a comenzar con la interpretación.
Thank you, Vidya, very, very much. And with that, Lindsay, would you call the roll, please?
Sure. Harriet Hall,
Present.
Kimberly Kropik,
Present.
Blaine Drager,
Present.
and Sherry John.
Here.
And for the record, a quorum has been established. Thank you.
Thank you, Lindsay. And moving right into our very first order of business would be the consent agenda. And I'm sure that the board has had time to look over the consent agenda. So if we can have a motion to approve the
So
consent
moved.
agenda.
Second.
Okay, moved by Dr. Krapik and seconded by Dr. Hall. Thank you. Let's see. Oh, and then we're going to move straight into the financial report. We had no one sign up for speaking
Sure.
today.
Sherry, just need to take a vote.
Oh, I always forget that darn vote for that one, don't I? Okay. What would I do without my vice president to remind me of these things? Lindsay, would you call for a vote, please?
Sure. Harriet Hall,
Aye.
Kimberly Kropik,
Aye.
Blaine Drager.
Aye.
Sherry John.
Aye. And the motion passes. Now we will move into the financials. No one had signed up for public comment today, and so we'll go straight to the financial report. And just to remind everyone in future that if you do wish to speak at the board meetings, we completely welcome that. We do like to hear from people, and we also do read your emails. So feel free to email. And with that, we will go to the financial report. Joe? I don't see it. Lindsay, do you see him on?
He is on and he is a co-host. Let me see. If I can get him unmuted. Okay, I can send him a text and see if he's having computer issues.
I
Sure.
do apologize. Are we
sorry.
up to the financials at this point? Unfortunately, yes, I am having some internet issues. Let me see if my camera will work. Good afternoon, members of the board. Apologies, I have not had an opportunity to update the agenda, but I believe with a new fiscal year, with the new calendar year, this is a great opportunity to delegate the financial statements to our new accounting supervisor, Salma Jacan. I believe she's on the line and prepared to present the financials. As always, me and I'm sure Jody as well are always available for assistance, support, but I have all the confidence and faith that Salma will breathe some fresh air into the presentations of the financial statements. Salma, if you're ready, if you could share your screen.
Thank you, Joe. Let's see. Can you guys see my screen? Okay, and can you hear me okay?
Mm-hmm.
Well, good evening, everyone. And thank you, Joe, for the introduction. So as of January and with 8% of the year complete, we are on target with our total revenues. We've collected 8% of our total revenues. However, I do want to point out that we are below our grant revenues by 2% due to some of our award agreements starting later this year, including our ARPA award and ELC award. Our charges for services are ahead of the prorated budget by 14%. This is expected to see each year. So far, we've collected 22% of our annual budget. We tend to collect the majority of our restaurant licensing revenues at the beginning of each year. So that puts us ahead, but our total revenues are on target with our annual budget. Our total expenditures are below the prorated budget by 3%. So far, we've only expensed 5% of our annual budget. This is due to salaries and benefits being below the prorated budget by 2%, and we haven't expensed any of our contractual services so far. We go ahead and scroll down a little bit. We are being underspent in these lines. The salaries and benefits and contractual services due to those programs that we haven't started yet. Those awards agreements are expected to start March and April, and we should start expensing more in these lines. Supplies and benefits are ahead of the prorated budget by 5%. Again, this is also something that is typical to see at the beginning of each year, as our staff tend to purchase supplies ahead or during the first quarter. And as a result of our revenues, mainly restaurant licensing revenues being collected, the majority of it being collected during the first quarter, the month of January, we have not utilized any of our county transfer. So any questions?
Questions from any of the board members on the financials? It looks like you explained it well, Salma.
Sherry, can I ask Salma a question?
Of course.
Yeah. Hey, welcome, Salma. It's great to have you. I just was wondering if you could share with me just briefly, what are some of those capital projects and equipment that we're looking at this year? That it looks like about a quarter of them have been started. Thank you.
Absolutely. Some of those capital projects and equipments does include software equipment, including computers for staff. And we are anticipating to start some of our awards, including ELC round 2, and we're adding staff. So as a result, we did purchase the majority of our computers, not the majority, but a good portion of our computer supplies during the month of January.
Thank you.
Great. Thank you. Any other questions from Board of Health members?
Okay, thank you.
Great, thanks.
And Joe, did you have anything else you wanted to add?
There we go. So sorry. Thank you for the opportunity to comment. You know, we're so early in their year. I think you know, a deeper dive, it's going to take a little bit of time. So I think we're on track. I think this is a great start to the year. I like to see some of those costs being incurred. You know, we want to make sure that we're supporting our staff, but it's very early to really dig into the numbers. But so far, things look good to me.
Okay. Thank you, Joe. Okay. Moving right into senior leadership team comments. We're anxious to hear from the senior leadership. Jody, I'm going to kind of turn this part over to you and let you begin.
Great, thank you so much. I have one announcement and then just a little bit of setup for the leadership. Then I'll turn it back over to you, President John, to further set things up and we'll go from there. The very, very exciting announcement that I have is I'd like to introduce a new employee. It's actually an employee of Jefferson County Public Health, but is our public health coordinator for Gilpin County. Her name is Elisa Witt, and I believe she's on the call this evening. And she started about 3 weeks ago. It's been kind of honestly a past few weeks, so I don't know the exact date, but I think about the beginning of February. So a couple of weeks now she's been with us, and she's really hit the ground running. She's been engaged in public health in Gilpin County for a long time. She's a member of the community, so she's well known up there, and just really excited, not just me, but the county commissioners in Gilpin County, elected officials, the community are all just really thrilled to have her on board. So please help me welcome her. Elisa, I'm not sure if you just want to turn on your camera and say hello, if you're able to. If not, I'm sure you will be seeing more of her in the future. Oh, there she is.
Oh, there she is.
Yeah, sorry guys, I'm here. I was blocked out from doing my camera and everything. So, but I'm here listening in. Thank you for the warm welcome. I'm really excited to be here. There I am. I've been, we had a volunteer advisory board here in Gilpin County for the last 4 years, and I've been heading that up as a volunteer. I was previously a teacher at the public school here in Gilpin. So I'm super excited to be coming back to my home of public health. I've been working in the field for about 25 years, and then took a brief stint at the public school to teach health and physical education. So I'm super excited to be here. Thank you. I've been here. This is the start of my 3rd week. So thank you very much.
Welcome.
Welcome.
Right.
And for, I guess, the next part of this, I don't have any further comments. I know with the change in the agenda, we're doing new employee announcements and things like that with our director comments. We're kind of mixing those in. One of the other things we're mixing in is the employee of the month announcement, which I believe Carrie has an introduction to do here in a moment. I didn't have an opportunity to touch base with all of the other directors before this meeting to see what comments they have, if any. So we will just have to go through the list today, but I guess moving forward, we'll make sure that we connect on that before these meetings.
Thank you, Jody. And one thing there's 2 things that I want to put in here, but as you all know, we need to back up 1 step so that we can approve the financial reports. My deepest apologies to you all. So may I have a motion, please, to approve the financial report?
I would so move.
Moved by Dr. Hall.
Second.
And seconded by Dr. Krapik. And all those in favor, please say aye.
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 Motion passes. Thank you all. Thank you for bearing with me on my votes. Jody, did you want to continue, or may I tell you the exciting news that the board that we talked about the other day about the meet and greets and the luncheons and stuff?
Yep, please do. Okay.
Well, the board wanted to do something really special this coming year for new employees. You know, it's hard when you first come into an organization and you're kind of lost and you're trying to get your footing and trying to figure out who you need to know and how do you meet colleagues, especially in this day when we're all seem to be on Zoom. And so one of the things that the board wants to do is to have meet and greets. And it will be held at the Parfit building. We'll see how many new employees come on at a time, but we'll either do it, you know, every month, or we could even do it quarterly. But we'll have, you know, snacks and be able to just meet each other and, you know, have a couple of board members there. So we're looking forward to having something special for the new folks that come in. And then for the employee of the month, we're also very excited. The board wants to do something special for the employee of the month. So we'll be doing a very special luncheon. It will be out in a nice place, and we'll have the staff that, you know, would be pertinent to that new person, and board members, and, you know, the leadership team. So look forward to that. And we do have you said we do have a new an employee of the month. Is that right? It's Katie. Is that right?
Yep, that is. And we can go ahead and when I can look at the agenda, I think Carrie is up in a few minutes. If you want to go through the list first, and then once we get to Carrie, we can go ahead and have her do that introduction.
Okay, there you go. Carrie, did you want to?
Well, I can speak about Katie right now as the employee of the
Sure.
month. Okay, so Katie Kerjack is our employee of the month for the month of February 2022. I am her current supervisor, and I have been her supervisor for the last number of years in the Nurse Family Partnership program. So Katie has served in Jefferson County Public Health within the Nurse Family Partnership program for almost 9 years. She's served hundreds of parents in Jefferson County, and she's completed thousands of home visits. She really stood out for this award, reflecting on the work she has done over the past year, 2 years, really pivoting with going from in-home visits to telehealth and really leading our team in some special work with how to support our breastfeeding clients in this new model, as well as really working to ensure, well, coming up with some pretty innovative ideas for client engagement, because it's different in how we engage clients via telehealth. The other thing I want to highlight is that Katie has served on a statewide committee for our Nurse Practice Council for Nurse Family Partnership, and she helped to write a mentoring handbook, which has been really beneficial to our team, as we have had 4 new nurses come onto our team who are being mentored. And Katie has really taken a leadership role. Katie's currently serving as the interim nurse supervisor for the Nurse Family Partnership. And I just really want to congratulate her on this award. She also took out a state representative on a joint visit for the Nurse Family Partnership. That was Lindsay Doherty. We do reach out to state representatives on both sides of the aisle. We always want to let people know the work we're doing. And so Katie was successful in completing that joint visit with Representative Doherty back in October. So congratulations, Katie. Thanks for joining us today. And thank you, Sherry, for highlighting this award.
Absolutely. And Katie, we look forward to meeting you in person when we have our special lunch. We'll be in touch very soon to get a date that works for everyone. Thank you.
Thank you so much. I appreciate it.
And Jody, did you have anything else that you wanted to share?
No, I think that's all I needed to share.
And Joe, from the financial world, is there anything that you would like to share as part of the leadership team?
You know, Sherry, not from the financial role, but I would like to take a brief moment to revisit some of the comments I made when I was Administrative Services Director. At that time, which seems so long ago, I made the comments that I was excited to give staff more of a voice, to focus in on listening to our team, to make sure that I was promoting their voices, that I was hearing what they had to say. It seems like we've come full circle. I am truly impressed. I'm encouraged by the senior leadership's commitment to that message. I think that we've all come back to that. You know, when I look around at the senior leadership team, I realize that we've all been here for quite some time, many years. I think I may be the newest of the group, and I'm pushing, I think, 8-9 years, something like that. So I think it's important for our staff to realize that we are indeed committed to the team. We are committed to, you know, the voices, the staff, the resources that we're so impressed with. The other thing I wanted to mention from a financial perspective is, you know, recently we executed, or we adopted a compensation strategy, which created a more of a structured approach to our compensation, to our salaries. So that way staff were compensated more appropriately with the attributes that they were bringing to their positions. We've just recently, I shouldn't say finalized that project, but we've taken a major step in that approach. And we've looked at those staff members who over the years have been not compensated appropriately. So we've made a little bit of an investment with our existing staff members. I hope that those staff members on the call, those staff members who receive those little bit of adjustments to their salaries, understand that that message wholeheartedly is being instituted within this organization. So I'm encouraged by the senior leadership teamwork approach. I hope that we continue to grow together as we move forward. Thank you, President John. I appreciate the opportunity to talk.
Thank you, Joe. And next up, we would have Elise Lovell. Would you like to chime in?
I would, President John. Thank you so much. I want to thank the board for approving the intergovernmental agreement with the City of Golden. We are very excited that the City of Golden is committed to providing healthier food and beverages for children within the restaurant structure. We're very excited that we're going to be doing education with restaurant owners and with the community at large to see if we can build on the healthy beverage work that our staff have worked so hard and developed coalitions to fulfill and make it possible. One of the aspects of the intergovernmental agreement is the fact that we have a registered dietitian who works within the WIC program and is also a lactation specialist, is doing the healthy beverage work. So it's expanding her voice and her opportunities to acquire new skills, and she'll be working with the restaurant inspectors. So it really is quite a lovely arrangement and a use of staff and working with the City of Golden. So we're very, very excited about that. And the last thing I wanted to share was one of our staff that you have heard about before, Pamela Gould, learned today that she is a finalist for the Colorado Women's Day Shattered Glass Award. And she has been nominated by one of our library partners for this. And there's a big to-do in March with a luncheon and all kinds of festivities where we will learn who the final finalist is, but she's in a company of very high achieving women. So we're very proud of her for that accomplishment, and we'll see how that goes. But thank you so much.
That's a big congratulations to Pamela. And that's very, very, that's wonderful.
Yeah.
Jim Rada.
Good afternoon.
There he is. Are you back? Are you back from your bathing in the sun that you worked so hard to get that vacation?
First day back. So you get me on a day that I'm still kind of jet lagged. So it's good that this meeting is moving very quickly. A few things that I would like to share with you. I wanted to put up a scene from where I was when I joined your special meeting last week, because it was looking at the Hanalei Pier on Hanalei Bay, but I'll spare you all the details there. Introducing new staff members. Last month, I introduced Katie Akashian. She came to us from Colorado Parks and Wildlife. Unfortunately, none of my new staff are on today because we forgot to invite them to today's meeting. There's been a little, so maybe next month you'll get to see all their faces. But we've also hired two more environmental health specialists who started in the last 2 weeks. Elizabeth Clyburn, Liz, comes to us from the City of Houston Health Department, Houston, Texas, where she was an environmental health specialist, comes to us with great experience. Also, James Yarborough comes to us from Tri-County Health Department. James has been with Tri-County for a few years. Both of them are joining us with experience and are really hitting the ground running in support of our retail food inspection program. We've also hired an administrative coordinator. Her name is Charlene Garcia. Charlene started a week ago, so everybody's real new but are excited to be on the team. Next month, I will try real hard to have them show you their faces to make sure, and we will hopefully have at that point our final hire. Finally, after 9-10 months, we will have be back to full staff. So, and then we can work on some of these other things like ELC hires. Let's see. Couple of other announcements or things I wanted to inform the board about. Last month, you asked us to begin to create a plan moving forward on some regulatory changes to our on-site wastewater treatment system regulations. Met with Roy Laws and Mitch Brown this morning. They have developed a calendar to hopefully bring a draft of regulation changes, proposed regulation changes to the board following the next couple of months of public input and really drafting. But we hope to have a draft to you by the May meeting as you requested. And then there's a mandatory 30-day review period for by CDPHE to ensure that we're following or we're not getting any less restrictive than the minimum state requirements. That will take place during the month following the May board meeting. And then with a hopeful public hearing date set for the July Board of Health meeting for regulation changes. Additionally, I have done a little bit of an initial outreach to some of my colleagues out in the field to begin looking at possible opportunities for developing a financial assistance program for homeowners who perhaps may not be able to afford higher level treatments or who might need some assistance with affording higher level treatment systems, as that appears to be the direction that we're moving with our regulations. So that's just an initial kind of heads up for you all as we begin to explore opportunities that may be coming through the ARPA funding mechanism and other possibilities out there. More to come on that. The final thing I wanted to let you know is earlier boards that we've worked with have had an interest in our retail food license renewal program. Just want to let you all know that, and you heard a little earlier on the financial report, that much of the fee funding that has been received so far is related to our retail food licensing program and some of our other smaller licensing programs like body art, on-site wastewater contractors, and so on. We're making great progress on collecting those fees and issuing those licenses. We do have a few that are delinquent, and we hope to have some warning letters out by the end of this month. You may recall that we do have authority to penalize those who do not renew their license as is required by December 31st of the previous year. We hope that through our normal process that we can put out and give them enough warning that those who have not yet paid will pay before we have to take any kind of punitive action. But I want you to know that we are progressing well on that, as is noted by the amount of money that has been pulled into this point in that program. And with that, any questions, I'd be happy to answer.
Yeah, and as our questions, board members, just to all my colleagues, just jump in. Kimberly, Dr. Kripik, you have a question.
Oh, I have a couple. First of all, Jim, I'm sorry I wasn't in that airline line to get on the plane with you like I was a couple years ago. I missed that. You didn't send me the notice.
Oh, sorry.
A couple things, if I may. It's interesting that you brought up the idea of us working to develop perhaps maybe some financial assistance for the on-site wastewater, because after that discussion, I believe it was a month ago, I started to think about that. And yesterday on, I think it was NPR, they were doing a story on the struggle of many of the Marshall Fire individuals who are starting the process of rebuilding their homes, but are finding out some of the building requirements that are now in place for greener homes, solar, that type of thing, are really pricing them out of the ability to rebuild their homes where they were lost. And so as I listen to that, I'm wondering if there might even be some opportunity for us to learn from how they are going to kind of get, I don't want to say get around, but work with those new, I think they were talking about a 2021 regulation change that came into being. And somebody else can probably speak to this much more intelligently than me, but it sort of popped into my head as I was listening to you. So just kind of FYI.
Was that through Boulder County?
It was through Boulder County, correct.
Okay. Mm-hmm.
And it was just on yesterday. So I can look and see if I even can get the link for you or Mitch or somebody to listen to. It was very interesting to me, something I hadn't even considered. So my second question is, I had somebody actually send me an email on Friday about the Radon Kits. And I thought that was in January, but they said no, that it was going to be moved to February. So is there any update on that? It was something about the kits not coming in time or something. I'm sorry, I don't remember.
I apologize too that I don't have a real solid answer for you, Kimberly. Oh, I see Terry likewise is raised her hand. Terry is helping to coordinate that. Would it be all right if we had Terry respond to your question there?
Yeah, absolutely.
Hi.
Hi, Terry.
So there was a delay in not so much the ordering, the receiving. So we were initially given a shipping date of February 10th. We did confirm with the supplier, they were having some delays in producing the Radon kit. So the last we were given, and this was today from our purchasing agent, that they will either be shipped on this Friday or next Monday.
Okay, would it be okay, and maybe Kelsey has to answer this, would it be okay if I just forwarded you that email and let you guys finish that? Okay.
Yes.
All right, great.
Yeah, and you can email that directly to me if you want, and I can take care of it. So once we get we have everything else. Once we get those kits in our possession, we will start putting them in the mail.
Okay, great. And then back, Jim, to a question, just a question or thought I had about the retail licensure and some of the delinquency. Is there a way that the health department knows of retail partners who have shuttered their doors as part of the pandemic? Or because we kept hearing over the last couple months that some of the restrictions that were in place with public health orders and that kind of thing were leading to businesses closing. And so I was just wondering if there's a way we cross-check for that, or we just send the delinquency notice.
Typically, our procedure would be that those that have not paid, we will print the letters and have our inspectors do a site visit to the location. And that way, if we do come across either a change of ownership that may have occurred or a closure, we would be able to note that in our system and make sure that we're not sending out a piece of mail that may not be read or received. So our first step on this collection process, if you will, is to send our inspectors out in person to those establishments that are delinquent, and either they collect on site or they, advise the operator to come to the the department or mail in their check with their application and renewal application as soon as possible. And then there's a deadline on the letter so that we don't carry this out too long.
Okay, great. Thank you. I'm just trying, we did some training on the Board of Health members, and one of the suggestions was that we strive to really kind of understand some of the ways that we do to get. And so thank you for explaining that to me. Sounds great. Now I'm going to quit monopolizing the conversation and allow somebody else to speak.
No problem. And thank you, Terry, for your input.
Jim, I also have a question on that. I guess just kind of a follow-up. So if they're delinquent, are they given a certain amount of time? Do we really try to work with them, since a lot of them have, lost a lot of days that they can be opened, or, a lot of shifts that they couldn't open? Do we work with them in a good amount of time?
Well, a lot of them, they were given relief last year, for one thing, when they were really experiencing the setbacks. Our typical procedure, Sherry, is when we can get to this first notice, and actually we're running probably a month behind right now because of delays in hiring and stuff. But what we normally will do is put a 2-week, they received their initial notice way back in November, so they've known this is due. And so they could be planning for payment up until this point. So we're giving them, upwards at this point of 3 months to make that payment. So we're kind of ratcheting down now, because we really don't want to have these delinquent license holders out there operating, without a valid food license. And so we want to make sure that we collect that revenue early in the year. So it'll be a 2-week notice. Second notice, it ratchets down even tighter. And then third notice, we begin to collect penalties on that. So they're given lots of opportunity to pay. And we do accept credit cards too. So there is opportunity to pay that way also.
Thank you.
It's me again.
Kimberly.
Is there a chart or a schedule of what those penalties are? Is it something that's readily available to those individuals to see, or is that an internal thing that gets done based on other criteria we're unaware of?
I believe it's included in the warning letters. The penalties are included in the letters, yes.
Any further questions for Jim? Well, thank you, Jim.
Thank you
for the update. Kelly Conroy, do you have an update you'd like to give us, Kelly?
I do. Good evening, everyone. I wasn't able to turn my camera or voice on earlier, but I just wanted to congratulate Katie Kurjak on our Employee of the Month. I actually helped bring her on 9+ years ago, so that's super exciting. I have a few new employees in clinic services. I don't see either of them on. First is Ryan Berger. He is a peer specialist working in our substance use program. And then our second new employee is actually was a longtime JCPH employee, was here for 20 years, went back to nursing school and worked for a year, and is now back at JCPH as a public health nurse in our clinic. And that is Jennifer Clabone. And I don't see Jennifer on either. So we very happily welcomed her back. Other than that, just a couple quick updates on COVID immunizations. Obviously, we're seeing a significant decline in demand. Some of our sites are seeing single digits to each site every day. So a pretty significant decline in vaccinations per week. So one thing that we're doing is the end of February, we will be closing our largest site. That will be in Littleton. It's at the Jefferson Marketplace. We've had that site open since the beginning of December. We've served thousands of people there, and we're no longer seeing those large crowds. So we are pivoting again, and so we will be doing smaller clinics throughout the county, working with our community partners to identify areas and sites, and just being very intentional and strategic with those vaccination sites. The timing was really good for all of this. We also learned from the state that some of the FEMA funding that was being used to support the state contractor who was doing a lot of those clinics for us, that funding is going to be ending within the next few weeks. So we will be shifting internally and using more of our staff and then some of our agency nursing staff to do those clinics throughout the county. And then in addition, we also, as you all know, we were anticipating being able to roll out the Pfizer vaccine for the 6-month to the under 5-year-old population. That's been delayed on the federal level while they await some additional guidance and approve that. So in the meantime, we are just awaiting that, and then once that approval comes, we'll be able to roll out that vaccine as well. And that's all I have. If there's any questions.
Dr. Hall, you have your hand up.
Yeah, so I have a question about boosters. So my understanding about booster vaccines is that there will need to be additional boosts because the effectiveness of the booster does wane over time, and that we are getting close to the time when the first people to have gotten boosters are basically in need of additional boosters. So I wonder if you've got any information about the planning around boosters, how they'll become available, whether that will happen, whether the other sites that have given vaccinations are gearing up to do boosters for additional people, et cetera.
Yeah, we haven't heard any real specifics about that yet. We anticipate it'll go through the same processes as the other approval of the boosters, going through the FDA for approval and then the CDC and the advisory committee for approval before we kind of roll that out. But that kind of looks like the direction. And I think the questions are around which groups will a 4th dose be approved for. Is that a blanket, or is it for specific subgroups of the population? So I think a lot of that still has to be determined, but we've heard just rumblings about it, but not more than that. Sarah and Dr. Rowan may have more information than I.
Should I go ahead? Yeah, there are certain people who can get a 4th dose right now. And so if you are someone who's immunocompromised, then you would be getting a 3-shot series up front. And then the 4th dose is the booster, but there's no universal recommendation for a 4th dose for non-immunocompromised people right now. And it's the data out of Israel is pretty mixed on how effective a 4th dose is for the general population. So I don't think it's a foregone conclusion that we'll be getting a 2nd booster for folks who are not immunocompromised.
Thank you. Any further questions for Kelly? Okay, we will move right back to Carrie. Carrie, will you pronounce your last name for me. Is it Reimersma?
Close. I'm Carrie Reimersma.
Reimersma. Thank you.
You're welcome. So I'll introduce myself again to those of you who have not met me. My name is Carrie Reimersma. I've been with Jefferson County Public Health for 14 years. I came in as a nurse home visitor, and I've worked as a nurse supervisor. Currently, I am serving as the interim director of family services. And what's included in family services is our nurse home visitation programs, as well as our injury and violence prevention, some injury and violence prevention, child fatality review, our regional health coordinator, and some of the Health Alliance work. So there's two new employees. I'm not sure if they've been introduced. They're not brand new, but I just want to make sure that they have been introduced in this Board of Health meeting. So 2 new public health nurses who are serving on the Nurse Family Partnership team, and they are Michelle Nagura and Kenyatta Adams. So I don't think that either of them are on this call today, but I wanted you to know that they are with us and they are very welcomed into our nurse home visitors, coming with experience. Kenyatta comes with over 10 years of nursing experience, and Michelle has experience specifically with the Nurse Family Partnership program from our partners that was at the Centura site. I just have a couple of updates. I wanted to speak to the fact that as our incidence rates decline, and we are moving more, we're not quite there yet, but we're moving more to less of that acute pandemic response. We are also preparing to have a return to our in-home nurse visits. So all those nurse home visitation programs that pivoted to telehealth. Even throughout the pandemic, we have done some in-home visits on a case-by-case basis when that has been deemed best practice and most appropriate. But we will be returning to more of those in-home nurse visits. We're excited about that. But as the world has changed these past 2 years, I think we will probably continue to have somewhat of a hybrid model where if the preference is for our clients or there are reasons to continue with telehealth for some of those visits. And we actually provided telehealth prior to the pandemic with some of these programs, like when there were weather-related things and of that nature. So we're excited to return to more of those in-home nurse visits. And the other thing that we are working on is more cross-division collaboration between our family services programs and our WIC program, just to better serve the clients coming into JCPH, because we have clients who may benefit from more than one program in JCPH. So we want to make sure that we are improving our cross referrals throughout the division and really making it maybe more of a one-stop shop. If someone comes in for one thing, that maybe they're made aware of other things that are available at the health department for them. So that's my updates, and I'm open to any questions.
Thank you, Carrie. Are there any questions for Carrie? Okay. Christine Billings, we know that you're here.
I am here. Sorry, I had to go my dog out, so I'm walking upstairs. I won't turn my camera on at the moment. We have, so some of the decisions that have been made, we have folded together our emergency preparedness program and our pandemic response work. So with that, I have 4 new employees who are on both sides of that picture. We have 3 new case investigators. So Mark Dargitz, Pat Vondenkamp, and Miss Caitlin Searle. And then Jennifer Verdon started yesterday, and she will be joining me as my wing person as an administrative services support to help organize a lot of the work that is ongoing and required by our ELC grant and the other grants that are funding our work. One of the other exciting things that we've done is starting Monday, Monday, we have taken back the communicable disease work, the routine disease investigations. So that's nice. So we have a staff member who is working on all of the routine investigations that we did prior to COVID. And so it's nice to have things like E. coli floating through my email rather than just COVID. So we have returned to routine disease investigations at the local level, and there are not many. Thankfully, the practices that were put into place during and our continuing response to COVID-19 kind of help mitigate other infectious diseases out in our community. So that is also positive news. And then our preparedness team continues to work on logistics. We still have requests for testing supplies, for PPE that continues to come into the health department. So we are fulfilling those requests, helping our childcare providers, long-term care facilities. They may hit a snag with supply chain. Supply chain is still a pretty significant issue, really across the nation and the globe for that matter. And so when there is a hiccup and they happen to be an outbreak and all of the things combined together, we are continuing to fill that gap to help keep our residents safe as possible with the use of PPE. So those are the major updates from our team that aren't data related and kind of fun.
Well, thank you, Christine. And then one other person that of course we have that we're very happy is she is part of the JCPH team is Dr. Rowan. Do you have an update for us that you wanted to share?
Thank you, President John. No, I didn't prepare anything today. I'm happy to answer any questions from the public health or medical provider side. But no, I didn't prepare anything today.
Well, thank you. We appreciate you being here. We appreciate you being on the team. Okay, is there any questions for any of the leadership team that you thought of after they were speaking? Do we have further staff comments moving into the next portion? I don't see any hands going up for the staff. Okay, we will go to the Board of Health comments. And one thing that I would like to do first is to introduce our very newest board member who is able to sign on today. We're very excited. The county commissioners did make their appointment on February 9th, as everyone was got a copy of the appointment, I'm sure, in your email. And she has joined here today, and I know I just saw her name. Hilda. It's Hilda Gerke. There she is.
Yes.
There she is. We want to welcome you to the board. It will feel like a fire hose and a landslide for a while, but everybody's here to help you get through all of that. We're just very, very happy that you've been able to join us. So thank you for being here. We appreciate it.
Yeah, thank you, President. I'm really happy to be here.
We're happy to have you. What is your, really quick, what is your, just a quick little synopsis of your background? We're interested in that too.
Yes, definitely. I just finished writing my bio, and a little bit about me. I migrated from Mexico about 26 years ago here in Colorado. I've been living in different areas in Colorado. Most of my time here in Jefferson County. I have a degree in psychology, and I'm a certified coach and a certified interpreter. I wear many hats, and I also have a lot of interest on businesses, especially cooperative businesses. So I'm really excited to be here and bring all these different areas of experience and expertise, and especially contact with the community members that I have been very involved in the last few years. So honored and happy to be here and to make any more contributions to make this county even better than what it is.
Thank you, Hilda. We appreciate it, and we're happy you're on board.
Appreciate it.
And then the one of the other things I wanted to say is you have now met probably the entire team, so they don't need any reintroduction, but we are really excited, and I was very happy when I was able to meet with Jody the other day to have the senior leadership team in place, and then to have one point person should a board member need something, or whatever the point person would be, Jody Irwin. And I said, you know, I love having this entire senior leadership team, but if I need an answer pretty fast, I can't go to 10 people or 8 people. So can we have one point person, please? And of course, him being the deputy director made just perfect sense that he would jump into that role. And then finally, one of the other things that I wanted to say was, you know, we've had so many questions coming in as to what in the world are you going to do about hiring a new person? And everybody's wondering, so do we continue doing what we're doing? Is everything going to change tomorrow? And so I just wanted to kind of address that, just to give you a quick idea of what we're probably looking at when we're hiring the new executive director. You know, this all happened really fast. And I will be honest with you, the board is going to take the time to really define what our values are as a board, what we're really looking for in an executive director. We're going to take the time necessary to be very thoughtful in selecting the next executive director. You know, we want to bring stability after the last 2 years with COVID and the pandemic and everything that has just been in change. And so we want to just take our time to be very thoughtful about the process. It's been a tough couple of years for everybody. It's been a tough couple of years for, you know, with everything that has gone on in the state and the county. It's been tough for the staff, and it's been tough for the community members. And so we want to just be very thoughtful and take our time to make sure that we really get it right. We want the public and the staff and the public especially to know that we are being take this very, very seriously. So we aren't going to rush into trying to make this decision tomorrow. So we will absolutely, the board will keep you updated as far as the staff goes and all the leadership team, and as far as the public goes. We will keep you informed as we move through the process, but we just want to give you reassurances that we're here to help build the team and work through the process. So thank you for your patience on all of that. And then I just wanted to, and I know my board members want to jump in, I'm sure. I want to take the opportunity to say a very, very special thank you to Kelsey Hall. She has been the right hand to this board. Yes, we're excited for Kelsey. I mean, she is moving on and will actually be closer to home, so she doesn't have to drive so far. But she has been the legal counsel for the board, and we are just very grateful for all of the work that she's done and the incredible amount of work that she had to do through the pandemic and through all of the COVID stuff. So her last day is on Friday, the 18th, so it's coming up. And we just want her to know how grateful we are. Kelsey, thank you for being here, and we wish you just the best of luck. You've been terrific.
Thank you so much, Sherita. That really means a lot. It has been such a privilege getting to work with all of you, and especially the staff at JCPH. I never could have imagined that I would get to work on the things that I have over the past couple of years. And I've met so many wonderful people. I've learned a lot. Like I said, it's just been a wonderful privilege. And I'm going to miss everyone. This is a change I needed to make for my family, but you all will be missed. And I really appreciate everything that you have done for me over the past 2 years as well.
Well, thank you. And I'm sure my board members want to jump in on this.
I would love to echo that. Yeah, thank you. Kelsey, you definitely will be missed. I wish you all the best. Thank you for all your support. And I also want to just echo the efforts to try to have some continuity, and really appreciate the executive team stepping up. We so appreciate the staff and how hard that they have worked, and how much challenge there's been over this 2-year period, and definitely looking forward to some stability. But do appreciate everyone, and know that it's going to be a little bit of a challenge during the transition, but we are very much looking forward to the future.
Thank you, Lane. Harriet.
So yeah, first, thank you, Kelsey. I sad to see the person with the same last name as mine leave. You've been a great help, and your wisdom has been very important as we've come through some kind of tough times with your guidance. So thanks. I want to extend a welcome to Hilda, and say that I'm glad to not be the newest board member anymore. And it is like drinking from a fire hose. I still feel like I am. We've been so consumed lately with COVID related issues and other things that have been going on that finding out there's some things I haven't found out yet about the organization that I need to. So we can probably do some learning together as well. I want to say that it's been really lovely today to hear from so many directors that I haven't heard from, and kind of met by Zoom before. So I'm really pleased about that. And that was a very nice part of today's board meeting. And finally, I want to issue, and I'm not sure there's anybody here to hear it, but I want to issue a thank you to any community members who are attending this particular board meeting today. Even though we're now hopefully through this period of turbulence and all the way through it, I hope, but thanks to them for being with us through thick and thin. And now when things are maybe looking a little less turbulent. Our work as a board, and more importantly, our work as a health department, is really dependent on our relationship with and our support from the community. This is absolutely vital, because so much of what we do is prevention. So much of what we do is public education. And we really have to have that collaboration with the community to do that. So I'm really hoping that some of those community members who came out to meetings and expressed dissatisfaction with what we were doing will also let us know when they're satisfied with what we're doing. Will also let us know the input that we need so that we can have a good two-way relationship with the community, listening and being heard both, because that had really kind of broken down. So that is pretty much everything I have to say. So
thank you, Harriet. Kimberly.
I forgot to welcome Hilda too. Oh. Sorry for that omission. I look very much forward to meeting you and conversing, and anything that you need, please feel free to reach out.
Kimberly.
Sure. Hi. First of all, I also want to express my excitement, Dr. Gerke, for you finding time and commitment, and it sounds like passion, to join the efforts of the board, and how exciting it is to know that your expertise will channel through the board down to this amazing group of people that you are going to have the privilege and opportunity to work with. So welcome. I want to first thank the commissioners, Commissioner Kerr, Kraftharp, and Commissioner Del Camper. Dr. Gerke's here because of the time and the commitment and the interest and the understanding of those commissioners to the importance of this board, the work that's ahead of us, the things that are asked of us, and on top of everything else the commissioners have to do on a day-to-day basis. I just want to thank you for taking the time and the thoughtfulness for getting us such an amazing new partner on our board. So I wanted to thank that. The second thing I'd like to do is to thank Kelsey. I have learned so much from you, and I have to say, you are the first attorney who has taken so much patience and time to help me understand the legal aspects of so much of what's required in this position. And again, I know how incredibly busy you are. And so to have had that time and that opportunity, I'm really going to miss it. But I wish you all the success and happiness and closeness to being at nearer home in your next opportunity. And then I also want to express how excited I am with all of these new employees in Jefferson County Public Health. The excitement, the ideas, the fresh perspective they're all bringing to our organization. With that, I want to speak to those individuals who have held Jefferson County Public Health together during the most difficult time in public health. I know there are many of you within the organization who are tired and who have had struggles throughout these 2 years and are going to have, I hope, an infusion of enthusiasm. But I don't want to have that new infusion of enthusiasm take away from the needs you have to get restored, to get refreshed, and to get back to a place where you're refreshed, I guess is the word. So please continue to communicate to the board members, to your directors, those kinds of things. We heard a lot about mental health stress over the last 2 years. And we just want to make certain that we don't lose sight and we don't lose the opportunity to thank you for all you did and are doing to help us get to a true finish line of the pandemic. I just cannot express my gratitude deeply enough for you all. I know some of you, I won't mention anybody's name specifically, have put retirement plans on hold to help us through this time. And so thank you, thank you, thank you is what I want to say to all of you. And that's it for me.
Thank you. Are there any further comments from the board? I know we are all just really grateful that we have the staff that we do and the senior leadership team that we do. And I feel really good about moving forward, and I do feel the excitement, and that's very encouraging. So we will all go through this as a team because it will take all of us to take things forward. Are there any other comments from the board? Well, good job, y'all. And it was a fairly short meeting, but we covered a lot. So I thank everyone. And with that, we will adjourn. Thank you.